Hello class, my name is Natasha and my project today is on ethics of healthcare. The ethics of healthcare affects every individual regardless of their age, religion, personal beliefs, and their well-being. Healthcare professionals are finding it more and more difficult to make medical decisions due to the legal and public changes taking place in the healthcare field. Fortunately, there are factors that can facilitate the process and alleviate the medical provider and his or her patient from falling into ethical issues. For example, the advance directives and the living will can allow a competent person to indicate what their preference and/or desires are regarding a procedure that may prolong their life. When a person believes that they may need health attention or a medical procedure done, they will be asked to complete an advance directive form. The advance directive form can be used to designate a specific individual and allow this person to make health decisions on behalf of an incapable person in case of a life-threatening emergency. This medical advance directive can be filled out at any time. You do not have to be an elderly person in order to fill this out. The earlier the better in order to secure your well-being. And this brings us to our next topic, which is the impact of ethics in healthcare administration. The cost of healthcare in the United States is increasing more than ever before. The limited amounts of resources in the healthcare field have been the cause for ethical allocation decisions. The ethical dimensions of decision-making, while concerns regarding accountability and resource allocation take place, the limited amount of resources affects everyone in the healthcare field. However, nurses have been affected majorly in this matter. The criteria that informs the administrative decision makers that the supply of resources are limited are the following: need, equity, contribution, ability to pay, patient effort, and merit. At this moment, I would like to welcome Dr. Margarita Hernandez and ask her to please tell us a little bit about herself.
Hi, thank you. I'm Dr. Margarita Hernandez. I'm a neonatologist. What I do is that I take care of babies in intensive care unit, and I work with South Day Neonatology.
What does ethics in healthcare represent to you?
For me, it's a series of principles that we follow for the patient's best interest.
And in your profession, is it considered ethical to admit faults in certain situations?
Actually, it's something that we have to do. If we have something that goes wrong, a medication that is given that is not supposed to be given, for example, we have to in my case, let the parents know as soon as possible. And the ethical thing, or the thing that is right as a physician, would be to let the patient or parent's patient to know about it as soon as possible.
Was there ever a time that you have considered not giving a certain medication due to a patient becoming addicted?
Yes, because before becoming a neonatologist, I was a general pediatrician, and I had a teenager patient that asked for a narcotic, a Xanax, in order to fall asleep because he had a broken bone and he thought he was in bad pain and he really needed it. But I explained to him that it was not indicated, that Benadryl would be the medication that is indicated, and it seemed like he had a history of abuse before. So that's why he was asking for such a strong medication.
Would you ever hide a terminal diagnosis in order to keep a patient from losing her faith against her life?
No, because we have to tell patients everything, and that's part of the things that they have to know. Even though it could be something that is hard for them to accept, we have to help them during that process, give support as needed, and let them know what's going on. In my case too, of when we're dealing with small babies, what's going on with them, and what the prognosis is, the things to expect in the future, and what it would mean. Sadly, if it's something that it would be lethal, we have to let the parents know.
In your many years of profession, can you think back at a time when you felt you had to do something against your beliefs?
Yes, it happened maybe around 5 years ago. I had a couple of patients, HIV positive, that had babies, and I asked them if the parents knew about it, and they said no, the dads were not aware that the mothers had this infection, and I could not let them know that they were being exposed to HIV because the laws do not let me tell the dads that this is going on.
And last but not least, have you ever had to break patient confidentiality in order to save your patient's life?
Up to this point, it hasn't happened to me. I haven't been to that point yet.
Okay. Well, thank you so much, Dr. Hernandez, for joining us today and
Thanks
allowing
for
us a
this
better
opportunity.
understanding of what ethics in healthcare is really all about.
Thank you.